guys, it's Shayna. I'm just preparing for my surgery and I'm looking over all the books and stuff. My surgeon had given me this big book on all their procedures and everything when I signed up for their program. It was $500 to get into the program, and that included like three what they call life skills classes, which is like how to, you know, what you should be eating, what you shouldn't be eating, how to deal with stress without eating, and things like that. And then they have like a clothing exchange and just a bunch of other nice, helpful kind of things. But I was looking over the book and I had seen this before and I didn't pay much attention to it at the time until I started seeing what other people were eating post-op, and it seems really conservative. So I'm wondering if anybody else has had a similar diet post-op. It's discharge through week 3 is a liquid diet, week 3 through 8 is a pureed diet, and week 8 through 3 months is a soft food diet, and then after 3 months is a regular food diet. So I'm wondering if anybody else had to wait 3 months to actually choose something. Regardless, I'm going to follow it. I chose this physician because he has a good record, and to completely not listen to anything he does and do my own thing obviously would completely undermine choosing a doctor that I liked. So, let's see. The only other thing I've been doing is just trying to prepare for surgery. It's in like 2.5 weeks. So it's coming up quick. And, let's see, what did I do? I got my prescriptions, and I got a transderm patch. I think that's what it is. It's the night before surgery. You put it behind your ear and you wear it to the surgery, and it's supposed to help with nausea and stuff, which hopefully that will do its job, because that's been my biggest issue in the past with anesthesia, is I get really nauseous for a good 24 hours or more post-op. And then I got like an acid blocker and things to prevent ulcers. And then I got a liquid Oxycodone that they wanted me to pick up ahead of time. They had me pick up all my scripts already, because in case they didn't have it in stock or whatever, that way there I just have it in my cabinet. I think that's in the Percocet family, which if it is, I'm going to try to avoid like the plague. I get horrendous headaches from Percocet. And with my first C-section I had it, and I felt like crap. And my mother was like, just get off the Percocets, go to Motrin. And that scared the daylights out of me, the thought of, having my entire stomach all open. And I'll just take some Motrin for it. But in all honesty, the Motrin worked just the same. And with my 2 C-sections after that, all I did was Motrin. I'm sure it was like a gigantic dose, but it was still, I wasn't on narcotics, and I felt a lot better. Which I don't think we can take Motrin now. So I'm going to have to see what I can take and what I can't. Hopefully I can just skimp on the narcotics and feel a little bit better, because I tend to find that it makes me nauseous. It's just, it doesn't agree with me. So hopefully I won't have to take too much of that. Then the only other thing they gave me was an antiseptic body wash to like clean with the night before, and to really, clean your stomach to make sure that the incision site is really clean and stuff. And that was, I think, it that they had given me pre-op. I'm supposed to have an appointment with a bariatric nurse before the surgery. She's pregnant. She's been out a lot, and I haven't gotten a call back from them, so I'm not really sure. I don't know. I wouldn't mind skipping the appointment, because I've had the pre-op with my doctor, and a couple days before I have a pre-op with my primary. So, it's just a pain in the butt to drag the kids out for one more appointment or try to get a sitter. So it wouldn't hurt my feelings if somehow that slipped through the cracks. Seems, I don't know. I've been really impressed with the doctor, but I haven't been overly impressed with things since I got approved with from the insurance. I don't know if that's just their normal way of doing things, or it may just be sort of chaos in there because, like I said, their bariatric nurse is pregnant, and I don't think she's felt very well. She's been out quite a bit, and their nutritionist is out on maternity leave, and there seems to be some other people out. So it may just be chaos because they're really short staffed right now. So hopefully things will improve. It really, the actual medical aspect of it, I've been really happy with. It's just the administrative stuff that I'm not really thrilled with. And there's only been a couple of small things. And then what else was there? Not much. Just hoping that nobody gets sick prior to the surgery, because we have been passing around viruses like you wouldn't believe, and the school keeps sending things home that kids are there with flu-like symptoms and blah 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 blah. And I can just envision everyone getting it, me ending up getting it, and then postponing the surgery, and or I come home to a house full of sick people, or so. Hopefully we can ward it off for a little while longer and not have to deal with that. And trying to think, there's nothing else. The kids are excited for trick or treat this weekend. And I will post pictures because I made all the costumes this year. I'm not quite sure what got into me to make my costume and all four of the kids' costumes, but apparently I've lost my mind with that. But yeah, I'll definitely post pictures at some point because my costume was pretty funny. So, not to, pat myself on my back or whatever, but alright, bye.